This segment is sponsored by Dominion Hospital. The CDC reports that 1 in 5 U.S. adults have been diagnosed with some form of depression, and 1 in 3 high school students report poor mental health most of the time. But people don't have to suffer alone. There are coping strategies, inpatient and outpatient programs, and more for people in the DMV suffering from a variety of mental health issues. And here to tell us what Dominion Hospital in Falls Church has to offer is Chief Medical Officer Dr. Gary Litovitz. Welcome to Great Day Washington. Thank you so much for being here.
Thank you, Elaine.
Of course. Help us understand why Mental Health Awareness Month is so important, and also how do you define mental health?
Well, awareness of mental health is important both for prevention and wellness, as well as for treatment of symptoms for those people who have symptoms. Wellness in mental health really involves managing stress. That's probably the most important thing we can do for ourselves, along with healthy lifestyle. The same kind of healthy behaviors and lifestyle choices that we hear about so much for our bodies, for our physical health, are also important for our mental health. Things such as exercise, eating well, and of course managing stress. So what does managing stress really mean? We all have very busy lives. We're dealing with competing priorities. We're pulled by the demands of work and by the demands of family, friends, or other things in our lives. And part of managing stress is learning how to let go of the stress that comes from one area of your life and not bring it into another area of your life. So for example, leaving work stress at work and leaving home stress at home can help your relationships at home to not suffer from that work stress, and can help your performance at work to not suffer from those other distractions. People have heard of meditation. That's a really good one. There are progressive muscle relaxation exercises. There's something called guided imagery, which is one of my favorites, because in less than 60 seconds, you can sit at your desk, close your eyes, and imagine a beautiful scene on a beach that you've been to for a summer vacation that really brings you back to a relaxed state. And then open your eyes and go back to work, hopefully energized and feeling better.
Yeah, it's great to kind of have some coping strategies to kind of relieve that stress. Can I ask you, what symptoms should someone seek help? What symptoms are they having that they should maybe go seek some help from a mental health professional?
Well, probably 2/3 or more of Americans have experienced depression or anxiety at some point in their lives, and at any given time, probably 10%. So depression and anxiety are the most commonly known mental health symptoms and conditions, but there are many others that are pretty common as well, including social anxiety, panic attacks, obsessive compulsive symptoms, substance use disorder, post-traumatic stress symptoms from psychological or physical trauma, eating disorders, and sometimes psychosis or thought disorders.
So these are some of the symptoms that someone's experiencing where they maybe should go seek help rather than maybe try and cope at home.
Generally includes a combination of medication and some form of talk therapy called psychotherapy. For years, there's been research showing us which medications seem to work best for which conditions. But a new thing that not everybody realizes is that there's now evidence-based psychotherapy, which tells us that general talk therapy to help a person process their feelings might be good for some things, but not for everything.
And Dr. Litovitz, how can I find the right care for myself or a loved one, and are there different levels of care for children versus adults?
Yes, there are levels of care higher than outpatient office-based treatment. So typically people start with office-based treatment of medication with or without talk therapy. But when that isn't enough, there are levels higher than that, including intensive outpatient, partial hospitalization, or inpatient care. At Dominion Hospital, we have programs at all of those higher levels of care that are specific to age groups, for children, for adolescents, or for adults. And we also have specialty programs, including programs that treat specifically eating disorders or complex trauma disorders or school avoidance, to name a few.
Okay.
Now, if a person is thinking about getting help or struggling with symptoms, it's important to talk to people. Talk to your trusted family members or trusted friends. Often you'll find that they're relieved that you're doing something about it. They've been concerned about you, and they may even share their own experiences with with getting mental health treatment, which can help you to feel better about the next step you're taking.
Yeah.
Taking that first step is the most important step in getting help.
Yeah. Dr. Lidovitz, thank you so very much. This is very helpful. Thank you.
Thank you.
If you are in Virginia, Maryland, D.C., or surrounding areas, you can call Dominion Hospital directly 24 hours a day to arrange for an assessment. Dominion's counselors and nurses can help you determine what type of care would be best for you. For more information about Dominion Hospital, call 703-538-2872. Again, that's 703-538-2872 or visit dominionhospital.com.